and welcome. Thank you for joining us today for our webinar on health requirements for incoming student. This webinar is presented by Student Health Services Director of Nursing, Annie Horn, who will oversee the incoming requirement process for the university. The Student Health Services nursing team will be your point of contact for this process, and they are here to support you as you work through these requirements. This webinar will be recorded and we will be posted on our website. I will drop the link in the chat. And many frequently questions asked will be answered throughout the presentation, but we will also have a designated question and answer time at the end. So if you have any questions, please feel free to add it to the Q&A button. And then visit our website for any more information on health requirements. And I will pass it over to Annie.
Thank you so much, Helen, and welcome everybody, and congratulations on accepting a position at the university. And this session is really going to help you wrap your head around the process for submitting and entering your incoming health requirements. And as Helen said, everything is available on our website. If that's the only thing you recall from this whole presentation, everything can be found there, all of the forms and the deadlines and the hold dates, etc. So why we have incoming health requirements is really to prevent vaccine preventable outbreaks from occurring on campus. And so from time to time, we have seen these outbreaks of, active tuberculosis, measles, mumps. In some parts of the country, there are small outbreaks of polio. So most of our requirements are really centered around respiratory illness, given that in the university community setting, we're all in close quarters and in lecture halls and halls of residence. And so outbreaks tend to spread more easily, and they do disrupt academic life significantly. So we really do our best to ensure that our community has really good high herd immunity. The health requirements include tuberculosis screening, and for those at higher risk, also testing. So when you complete the TB risk screening questionnaire in My Student Chart, the system will tell you whether you are required to test or not. So if it doesn't give you that message, then you can rest assured that your requirement for TB is complete. The immunizations that we require include Tdap, MMR, chickenpox, meningococcal, and the COVID-19 updated dose. Primarily, influenza and COVID will more be a fall-winter updated vaccine. The COVID vaccine is starting to be updated annually in exactly the same way as influenza is. So we have some different options available for you for that requirement. Starting the process really, as both Helen and I talked about, is really going to our website. And I want to give you a quick tour of our website so that you know where to find all of our information. So on our landing page, there's several ways to get to the information that you need. There is a quick link down here, health requirements for incoming students, or it can be located in resources, so health requirements. So there's two ways of quickly getting there. And as I said before, all of the information and forms are available on here. So our TB testing form is here. If you are prompted to test, there's lots of information and instructions there. And then this is the form that you will need to take to your healthcare provider. And then we have the immunization requirements and the immunization form that is a really useful guide, even if you don't need to use it and you have your own vaccine records. If you're needing to get catch-up vaccines or you're missing items and not sure about it, please do take this form to your healthcare provider, and it will give them lots of information on exactly what we are requiring. Also on this form is the COVID-19 information. And then the second page of this form are not required but highly recommended vaccines. Primarily would be useful if you are planning on doing travel abroad or you are using Student Health as your primary care provider. This information is really helpful to have entered in, but it does not form any part of the university requirements. It's more useful clinically and for other administrative purposes. It does have information here about the COVID-19. There is a COVID-19 declination form here. There is a process around medical exemption for any vaccines, and there's a form that you can take to your healthcare provider to have filled in. All of the forms are conveniently listed here. There are specific forms here for the medical school, School of Pharmacy, and the Physician's Assistant School. There are links to websites on our policy and other places that this information is pulled from. And then if you are coming into our Extension International program, there are specific directions for there. And then finally, there is the professional schools section and webinars and questions. So there's lots of really, really useful information there that you can come into. There is instructions on how to activate your My Student Chart, which we will go through in a minute. And there's also a link to My Student Chart. So that can be really useful just to take you directly into that from one central place. Okay, so signing up for My Student Chart does require that you have been given your AD login, which is your UCSD email and password from the university. Not long after you accept, they will provide you with that information. If you are having any issues in getting issued with an AD login, there is a link here, which is the University Blink website, which they do have IT folk there that can assist you. If you accepted late into the university, it might be that you haven't yet got that yet, but mostly most of you will have had that and had the opportunity. The very important part from my perspective of you signing up for My Student Chart, even if you don't start this process immediately, is that I can communicate with you. I can send you reminders of impending deadlines and hold dates. Without that, I'm relying on email, and given that you are all probably receiving a lot of different emails from the university, it's not always a reliable way of getting the message out to you. So if you can make sure that you access My Student Chart, that would be fantastic. And this is the landing page, and I'm going to show you very soon, but I just want to draw your attention that there are two different ways to log in, and the lower one is not for students, that's for regular patients of UC San Diego Health. We have our own special login that, as I said, you use your AD login. If you go through the incorrect way, you're probably going to be asked for links, or if you've been an employee of the university, it'll take you to that site, and you will not see any of the student specific items in there. So you really need to go back if you're seeing something and it doesn't quite look right, back out and then come in using your AD login, and you are most likely to hit the right place. And so now we're going to do, I'm going to take you through what My Student Chart looks like. So I'm using a test site, so it is not quite the way yours looks, although the front does, but yours will have My Student Chart, not My UCSD chart. And your login is here. I'm using a test patient, so it's a little different. So this is the landing page of My Student Chart. So all of UCSD uses the electronic medical record called Epic, and this is your portal into that system. It's if you are utilizing us as your healthcare providers, it will be how you communicate with us. And there's lots of good functionality. You can schedule your own appointments in some parts of the clinic and optometry, etc. So it's a really useful portal. Some things I want to highlight in regards to the incoming requirements include Ask a Nurse. So that is where you will go to ask questions from the nursing team regarding any aspect of this process that you're not sure of. And so it's a custom page, and it comes directly to the nursing team. You can pick a topic and then write your message. Now, it does come in with all of your name, your PID or your A number, your medical record number, your student number. So you don't need to list all of those things. Also, it comes in, we can see that you're incoming for fall or summer or whatever your incoming date is. So you don't need to put all of that information in your messaging, but just put exactly what it is that you're asking us. And we try and turn those round as fast as we can. Generally, it's within 24 hours, although around deadlines and hold dates, it may take longer than that. We do have nurses working remotely after hours and in the weekends that are assisting as well. So we aim to turn these around as fast as we can. The next thing I want to highlight is going back to the menu and to COVID-19. Now, COVID-19 sits a little bit separately in terms of your vaccine doses, and so this was built during the pandemic, so it sits just a little out from the other vaccines. So you will go to this page, and why I suggest you do that first is if you hit the update button, it's going to search vaccine registries, particularly within the state of California, and other instances of EPIC that might be used in other parts of in other health systems as well as the UC system, and it will pull information, vaccine dates in. So it will cut down on some of the work that you need to do. But this is where you will go to enter your COVID vaccine dates. As for the TB and the rest of the immunisation, you'll go back to menu and scroll down until you get to immunisation and screening. And on this page, you'll see both your TB screening and your immunisation history screening. So TB is a series of questions, and as I said, the system will prompt you if you need to do testing. So you'll just go ahead and answer the questions that it presents to you. And then for the immunisation, you'll go in there and it will have all of those that are listed. If you already have vaccines in there, it won't be an option to enter it. If you hover over the little bubbles, it will give you information clinically on what the requirement means. There are more boxes than you need to enter. Don't think that because there's 4 boxes there that you need 4 vaccines. Just check what the requirement is, which for MMR is 2 doses, and you can enter those. If you received MMRs, measles, mumps, and rubella vaccines as individual vaccines, you can enter them in there. If you choose to get a blood test, you can enter those into here as well. There will be spaces for that, for proof of immunity. So that is, and it will ask you to upload something with that. At the end of filling out all of these pieces of information, it will ask you for a document, and you will not be able to submit without adding a document. So you can use our form or your own vaccine records. You can upload as many documents as you choose there, and then you'll submit. You only get to submit this form once. So if you, for example, were missing a meningococcal vaccine, and you go off to your doctor to get that vaccine, you'll need to reach out to us and ask a nurse and upload a copy of that, and we will add that to your record. You're not able to go back in there and edit that at this stage. So those are the main parts of this process. So really everything that you need to know is in the menu, but this is going to be the main page. If you are required to provide TB testing after you screen, a little upload button will remain there until you come back and upload that form. Okay. So now we're just going to talk a little bit more about this tuberculosis risk screening. So the deadline is July 10. Academic holds go on July 31st, and so you really want to get this information in as soon as possible. Lots of people are submitting now, and why I say that is because sometimes you are needing to do more testing, or your testing is out of date, etc. There can be issues that slow this up. Complete your questionnaire. If prompted, take that form to your healthcare provider. The type of testing that we accept includes skin testing, blood testing, which is called quantiferon or T-spot, depending on where in the world you are. It's pretty much it's the same thing essentially, or a chest X-ray. If either of these are positive, then you will also need to provide a chest X-ray, and we do need to take a look at the chest X-ray report that's issued. And it needs to be in English, so it will need to be translated. A student health RN will review this submission, and then we will let you know if your testing submission meets the requirement or not. Very important to go back into My Student Chart to keep an eye on messages coming in. Set it up with some sort of alert, either email or text, so that you know when we've reached back out to you, because you don't want to miss something critical that you need to do before you come to the university. If you get an academic hold on for TB, it will prevent enrolment in full classes. If you're running behind or late with your submission, as soon as you submit and we process that, that hold will automatically be lifted. The regular immunisation, again, July 10 is the deadline, but holds are not placed until partway through the fall quarter. We allow you some time to obtain missing vaccines. For example, in many parts of the world, Tdap is not available. You might need to get blood tests, or there may be aspects of this process that you're having trouble completing. And so we do give you some time to get onto that. What else I think I've gone through most of this. You can submit even if you know that you're incomplete, and then, as I say, catch up with the rest of what you're missing during the full quarter. Just going through these vaccines in a little more detail, the Tdap is an adult tetanus and diphtheria and pertussis. Pertussis is the piece that we require, which is whooping cough. So many of you will have either received a pediatric or a childhood DTaP or a TD, neither of which meet the requirements. We need you to have an adult dose on or after your 11th birthday. The next one is varicella or chickenpox. We need you to have 2 doses, with the first one being on or after your first birthday and at least 28 days apart. So some of you may have received that first dose a little early and it doesn't count. So the other option is to get a blood test called a blood titer to check for antibodies to see if you have existing immunity. If you had chickenpox as a child, then the blood test is what you will need to do. The same rules apply for MMR as do varicella. 2 doses, with the first being on or after your first birthday with at least 28 days apart, or a blood test. If you had vaccines as single, you need 2 doses each of measles and mumps and at least 1 dose of rubella. So we'll be taking a look at that when you submit. The meningococcal vaccine is for students younger, 22 years or younger, and you need to have had 1 dose on or after your 16th birthday so that it provides you some protection through your college years. Brand names in the US include Menactra, Menveo, or Med-Quadfi. This requirement does not include the meningococcal B vaccine. Some of you may have received that, but this is the straight meningococcal ACWY conjugate, or polysaccharide is fine, depending on where in the world you are. So yeah, if you have turned 22 and are older than 22, you will no longer be needing to submit this vaccine. The COVID-19 mandate. There are a few different options here. You can postpone this until the fall. So as I said earlier, in the US, the companies that produce the COVID vaccine are updating it to reflect the current circulating variants every year. So each fall, it is predicted that a new one will be released. And so the most recent one was in September 2023. You can decline to have this vaccine for strongly held beliefs. And the option to do that is on the main immunisation form at the bottom. You can take and sign, initial that, or there is a whole separate form on our website. If you had past reactions to the COVID vaccine, you can apply for a medical exemption, and that is reviewed by our medical directors. But yeah, many people, you can just let us know if you want to postpone that till the fall. So really the only vaccines that we know of is Pfizer, Moderna, or Novavax that has updated. Most of the WHO approved vaccines, to my knowledge, haven't yet moved into having updated doses. You are welcome to enter those earlier dates because it's really useful to have all your vaccine records in one place. So please feel free to submit if you've had previous doses, but we will be recommending that you get an updated dose. Some frequently asked questions that we have. Sometimes people have challenges finding their vaccine records. So you can go to your healthcare provider clinic, high schools, other colleges you may have attended, early childhood health records. They are all places that you would head. If you can't find any of your health records, I would recommend taking our form to your healthcare provider, asking them to order blood tests to test for immunity. But in that case, you would still need to get a current Tdap and meningococcal because these are not available to titer. If your vaccines aren't available to you where you are, or you don't have insurance, or there is some other barrier to you receiving some of these vaccines, then you are welcome to get them when you come onto campus. There is no charge if you have UC Ship. We run clinics, really fast turnaround clinics for COVID, flu, Tdap, and HPV that are really convenient. And then we have a nurses clinic also offering all of the other vaccines. Appointments for these fill up very quickly in the fall, and they are all booked online. So if you think you may need something about at the beginning of September or late in August, the system allows you to start scheduling about 30 days out from the date. So just start thinking about that, set a reminder so that you can take advantage of receiving these vaccines early in the fall quarter. Some people have had a TB vaccination as a child called a BCG vaccine, and many folk ask if they still need to get TB testing, and the answer is yes. It doesn't offer lifelong protection, nor does it protect against latent TB, which is an inactive form that still is recommended that be treated. You know, if you've had a BCG vaccine, you'll have a little indentation on your upper arm, and the fact that you have had a BCG vaccine means that you were likely born and lived in a high incidence country, and so you will need to get TB testing. BCG vaccines can give a false positive skin test, so we do recommend, if it's available to you, getting a quantiferon blood test. The quantiferon blood test really is the gold standard for testing for TB, but also we do accept the other two, the skin test and a chest x-ray. Sometimes chest x-rays are the only thing available to you, and that is okay. Unfortunately, it only tells us if you don't have active TB. It doesn't tell us if you have latent TB. So if you get a chest x-ray only for screening purposes, we will reach out to you during the full quarter and suggest that you get a quantiferon blood test in the US or here on campus in our lab. If your medical records are not in English, usually most vaccine records are automatically translated, but you will need to get translation done if that is not the case, or your chest x-ray report is not in English. If your religion excludes being able to receive vaccines, you can decline the COVID-19 vaccines only. The other vaccines are not available to be declined on this criteria. If you have any allergies or past reactions to any vaccines, then you can apply for a medical exemption, which will be reviewed fairly quickly. And just a word on deadlines and enrolment hold dates. So the tuberculosis one is early, so really to focus on getting complete for your TB requirement first to avoid that hold. And it requires that you do both the TB risk assessment and the testing if it's required. So both of those pieces if you need to test, and for everyone else it is the TB risk assessment will mark you as complete. I will be sending out reminders and I will be sending out messaging if I know that you are most likely to get a hold because we haven't received something. So do keep a lookout for that in my student chart. The immunisation deadline and holds aren't on until partway through the full quarter, as I said, so you can obtain anything that you might need here. All students are eligible to use student health services. The difference with it is that if you have UC SHIP, all of everything is covered. If you have RAFT, some things are covered, but not the vaccines themselves, although there are many retail pharmacies where you can obtain vaccines easily, but blood testing and quantiferon testing is available to you as a RAFT student free of charge. And then if you opt out completely of any of those options, then you would pay out of pocket if you choose to have them here on campus, but again, there are retail pharmacies very close that run most insurances, so that is another option for you. But you are always welcome to ask us through Ask a Nurse if you're not sure. If you are intending on keeping your outside insurance, I would strongly, strongly recommend opting into RAFT, which is a access fee, which gives you so many benefits here at Student Health for fairly low cost. And you'll be able to come in and see our primary healthcare providers and urgent care for very low or to little cost at all. So it's a really good and convenient option for many people. And in terms of getting help, the primary way, assuming that the help isn't regarding setting up your My Student Chart, is to go to Ask a Nurse. If you are having any sort of technical issues, there is an email address here that goes through to our medical records, and we will have a team to try and assist you with any technical issues, VPN issues, or anything else that you're struggling with. Please don't send any health information on the email because it is not a secure or safe way to send health related information, and everything else you can find on our website, and please just make a start and get going as soon as you can. And then this is some of our nursing team, and these are some of the people. There's a lot more of them too that will be assisting you along the way. We're here to support you as much as we possibly can. We have a really large team of nurses and medical assistants that are here to help you with this and to get you through to full compliance on all of our requirements. So please don't hesitate to reach out.
Thank you so much, Annie. And everyone, we are now going to be moving on to the questions and answer part of our discussion. All right. My chart, my student chart says one of the required vaccine, meningococcal vaccine, is for students up to the age of 23. I am 24. Do I still need to get it?
So it's required up to the age of 22. Between 22 and 23, it's strongly recommended, but after the age of 22, it is not required.
I am over 50 and will be getting a single shingle shot. Does that cover the varicella requirement?
It doesn't. So what we would need you to do is to actually get a blood titer, just to show that you have adequate immunity. Most likely you would have had chickenpox in childhood, and so it is recommended that you just get that blood test. I'm sure you have plenty of immunity.
If I get the MMR vaccine in Korea and the varicella and the Tdap vaccines at CVS, do I need to submit documents with the provider signature and stamp for each document?
You do not, as long as you can provide us with some proof that you've had the vaccine. So it could be a printout from CVS. That's totally fine. You don't have to take that back to your healthcare provider.
I am from India and have taken Covaxin, which is internationally accepted. What do I do as the immunization form asks to circle Pfizer, Moderna, or Novavax?
Yes, earlier on in our COVID requirement, and we still recognise that WHO approved vaccines are acceptable vaccines. Unfortunately, you will no longer have any immunity from them because they came out in 2021, 2022. So you're welcome to enter Covaxin. The system will allow you to enter all those WHO approved vaccines. But really for an updated dose, that's why we want you to have Pfizer, Moderna, or Novavax, and you can obtain those once you come to the US.
Is one dose of meningococcal ACWY sufficient if given after the age of 16?
Yes, it is. Just you only need that one dose, and that provides sufficient immunity for up to 5 years.
If my current provider uses my chart, is there a way to share some of the record with this clinic?
Yes, there is. Um, ask your provider to make sure you're enrolled in something called Care Everywhere, and we can push a button and pull all your vaccine records and any TB testing, etc. And if you're not sure, you can send us a message to Ask a Nurse, and we can see if you're already in there because we can see if you're enrolled in there and search. So yeah, that's a really, really good question.
If we are missing a dose of a vaccine, should we get vaccinated ASAP before the July 10th deadline?
It's best to get as many vaccines as you can prior to that date, but if you can't, then we do allow that extra time.
If we have our own vaccine records, can we report them ourselves without going to a medical provider?
Yes, you absolutely can. And if there's anything missing or unclear, we will reach out. We'll send you a message and ask you to provide something additional if it's not quite adequate.
If I have not turned 18 yet, is it expected for me to have the hepatitis vaccine before the due date, or am I only required to have the main four that are listed on the applicant portal?
Yes, hepatitis B is no longer a required vaccine. It was some years ago, and it still is for our incoming professional schools. So no, you should really have Hep B though, if you haven't already, because it's especially if you're playing contact sports or thinking of going into any sort of healthcare profession, it's really good to have that, but it's not required by the university.
Can I use my immunization record from my previous school, for example, UC Berkeley immunization record?
Yes, you absolutely can.
How does it work if your immunization information from a different healthcare provider is connected to UCSD Student Health? Do you still need to submit that form?
It really depends. I would encourage you to send a message to Ask a Nurse and we'll take a look because you do have to activate the compliance. Even though the vaccines will be sitting in there, the compliance won't have been triggered. And so it's really important to check that we have everything and that compliance has been triggered so that you don't inadvertently get a hold on in November 1st.
Can we send our immunization forms to ask a nurse for someone to check if it's sufficient or missing any information?
No. What we would ask you do is just to submit what you have and then we will review it because we don't really have the time or capacity to do that. So just go ahead and if you've got any doubts or gaps, then perhaps take it to your healthcare provider to do that piece.
The TB test is good for how long? Students who have the TB vaccine will test positive. Is that taken into consideration?
So TB testing needs to be within the year of matriculation. So that's September 23 to September 24. And the TB vaccine, the BCG, will turn potentially, not 100% of the time, will turn only the skin test positive. So you still have the option of quantiferon or chest X-ray. If you've had TB, latent TB or active TB in the past, you shouldn't have a quantiferon or a skin test. You should go straight to the chest X-ray because it is not known how if that will stay positive forever. But if it's just BCG causing false positives, that only occurs in skin testing.
Right. For the meningococcal vaccine, if you are 23 and above, do you still need to provide that?
No.
For international students, when filling out the immunization form, it asks for the provider's signature, name, and practice stamp. Are there any guidelines for how this should look like? I'm particularly not sure if there is an equivalent for a practice stamp in my country.
You're from Mexico. Yeah, they probably do because we've seen lots of records from Mexico, but they can just put their practice name and address and telephone number, just something that is identifiable.
For non-English documents, do I need to submit both the original and the translated version, or only the translated version?
Just the translated version is fine.
It's been over 30 years since I got the MMR. I have no idea how to get that record. Will a blood test demonstrate that I have received that?
Yes, it will. So it'll test for immunity for all three diseases. And if you're testing low, we would recommend that you get a booster shot, and then and then you could retest 4 to 6 weeks after that.
I had my first MMR dose at the age of 1, but never got a second dose. If I were to get one now, does that count as my second dose, or do I need to start over?
No, that will count as your second dose. So there's really no maximum gap between the vaccines, but there is definitely the 28-day minimum.
How many doses of meningococcal vaccine do we need to provide?
Just one on or after the 16th birthday.
What if I receive multiple vaccines of the same one? Would I post the most recent one?
Yes.
When is the earliest date for our latest COVID vaccine to be considered valid?
It will be since September 2023, or you can postpone and get the next one coming in fall.
If we go to the immunization and screening and don't see the TB questionnaire, does that mean we did it already? I can't remember if I already completed it, but I can't find it anyways.
It probably means that you already did it. If you're a returning student, as in you're going from undergrad to grad, it could mean that you did it as an undergrad. Please reach out to us through Ask a Nurse and we will reset that for you. So for folks transitioning from undergrad to grad, you will need to repeat the TB requirement, and mostly I've gone in and reset all of those. Every so often with late acceptances, that might not be the case. If you don't see it there, please reach out to us just to confirm.
For my for my vaccination documents that are not in English, can I translate them myself, using Google Translate?
You can. If there's any confusion on our behalf, we'll reach out to you.
Is the flu vaccine required?
It is, but not until the fall. And as I say, we run these mass clinics and we often give COVID vaccine and influenza vaccine updated doses at the same time. So it's required in those fall and winter months. So you don't need to get it now for your incoming for the fall.
Where can we translate our medical records?
You would just search in your local area for medical translators and or some sort of translation service.
There's only 3 COVID vaccines, correct? I've gotten the first 2 and one other after that, but are there any more?
Yes. So actually, there's probably been 6. I think I've received 6 since the beginning of when they first came out. And so what we're looking for now is a current updated one. Yeah, the most recent one, as I said, came out in September of 23, and there's another one due out this fall.
I've received the MMR and varicella vaccine recently. Can I submit my doctor's report as proof of vaccination, or do I need to wait a month to get the blood titers?
You will have needed, for completion, you will need 2 documented doses of each. You don't, yeah, I'm not 100% sure of all the facts there, but if you've got 2 documented doses, that will reach compliance. If you just didn't have your previous records and just got one, you will need to wait a month and get titers done.
Is vaccine proof from the doctor sufficient, or is the UCSD form required?
No, you can use vaccine proof from your doctor. That's fine.
Can we send our own immunization form received from our high school to ask a nurse for someone to check if it's sufficient?
No, just go ahead and enter the vaccine dates, and then we'll let you know if you need something additional.
How and where do we submit the documents? Like when we get vaccines that we would need to submit to provide the proof.
So it was in that online form with the date fields. So you enter them in there, then at the bottom there's an upload of documents button. That's where you do it within My Student Chart.
I have checked this. I have checked my student chart for my vaccine record. It does not let me record my vaccine since it states that it has already been electronically linked to my records. Would I be contacted if I'm missing any vaccination from the record linked?
No, not necessarily, and I would strongly recommend you send a message to us so that we can take a look and activate your compliance.
About the immunization form, does the third page also have to be filled out by the healthcare provider, or can I fill it out myself?
I presume you're talking about the strongly recommended vaccines. Either is fine.
I have already filled out my medical records and my TB questionnaire and was told I do not need testing. Do I need to still book an appointment with my healthcare provider to fill out the form? Additionally, my medical records did not include a requirement for meningococcal. I've taken a vaccine for the pneumococcal,
Pneumo
though,
yeah,
the
pneumococcal.
pneumococcal.
Yeah,
S-
perfect.
So I'm wondering what I should do.
So no, if you don't need testing, that form does not need to be submitted. You have completed your TB requirement. And if it didn't include meningococcal, I'm assuming it's because of your age. So you don't need to worry about it. If you need to send a message and just confirm that, you're very welcome to. Pneumococcal is a completely different kettle of fish. It's only medically indicated for certain people, so and it doesn't form part of our requirement.
I'm currently outside my home country for a month. Is there any way I can get any extra vaccines I don't have already once I get back to my country, but before starting the fall term?
That's fine. Yeah. I wouldn't, obviously, the TB thing isn't, that's, you'll miss the whole date, but definitely for vaccines, yes.
When submitting the documents regarding our immunization record, am I allowed to submit a paper that has stamps with the dates from clinic in which I received them?
Yes, you can.
What do we do if we miss some updated COVID booster shot? Is it okay to get the latest dose now?
Yes, it is. In fact, those earlier doses, well done for getting them, but they really mean very little clinically at this point. So to be up to date, you only need one current updated dose. We don't call them booster doses anymore. It's just a current and updated vaccine.
I got my Tdap vaccine at the age of 14, but it has now been 10 years and has expired. Do I need to get another dose or does this comply with the requirement?
It complies with the requirement, but as far as your health goes, you do need to get an update to protect you from tetanus, which is present in the soil. So yeah, I strongly recommend you get it, but you will meet the as far as incoming requirements go.
I am a transfer student for fall 2024. I have a question about TB screening because I'm currently not in the US now, and I will not be able to make it back to the US before the July 10th for the TB test deadline. Can I have an extension on the form required for TB tests?
You can get tested for TB anywhere in the world. You don't need to be in the US to get tested. So, extensions really are only for very extenuating circumstances. So wherever you are, if you can access healthcare, you can get TB testing there. Many of our TB submissions are from outside of the US. So yeah, please go ahead and get that. And if you're having issues with that, then reach out to us and it will come through to myself and we'll take a look at your situation.
I am from India. Would I need to get TB testing?
Yes, India has TB endemically, and so it's very important that you get TB tested from if you are coming from India.
What do we need to include for the proof of upload for vaccine history? Does this need a doctor's signature?
If you're using your own vaccine records, it does not need a doctor's signature. If you are using our form, you do.
If we have some booster shots or vaccines missed, we can still go ahead and complete the immunization form. before the deadline and still get the vaccines, right?
That's right, yes.
Whether my student chart is filled out by the student and not the provider, only upload the file is filled out by the healthcare provider. Is that
Yes,
correct?
yeah, that's correct. So that your healthcare provider won't be accessing your chart to enter those things in through your portal. Um, yeah, you're just uploading the form that they provide for you.
If we receive the Covaxin manually, will the hold be the same until we get one of the vaccines provided? Will the hold affect enrollment?
I'm not entirely sure what that means. You do have there won't be a hold placed um, before you come to school for COVID-19. So you have the full quarter to obtain a more updated dose than Covaxin.
Do I need to report the 4 vaccines listed in the applicant portal?
Yes. Yes, that's correct. Those form the requirements. The applicant portal and the My Student Chart are two different things, and the two do not communicate. If you think, if you see something about your complete on the applicant portal, they don't communicate because we don't share your health information with any university system. So you need to make sure that you are complete for those 4 vaccines in my student chart.
If I've never had a COVID-19 vaccine, is it okay to wait until the new one in the fall?
Yes, it is.
If I submit my TB information after July 10th, but before July 31st, will I still have placed on will I still be placed on academic hold?
No, well, it depends. So obviously we're receiving hundreds and hundreds of these submissions every day, and we can be at 10 days out. So information received between July 10th and July 31st, there may be a slight delay in processing that. So that's why we try and encourage everyone to get it in by July 10th. However, most years we are up to date by the time the hold gets on. It's only a tiny small amount of people that might have submitted the night of the 30th that end up with a hold. But as soon as we do process your submission, then we have a report that runs Monday to Friday that will lift those holds up off your account, and you'll be able to enroll as per usual.
What should I do if I'm unable to provide translated vaccination record by July 10th? Do I submit the original document first?
If we are not able to decipher the vaccines you've had, it probably isn't worth doing that. What if you submit after July 10, it will still be okay. We really just want people to get started and get as many of the vaccines in by July 10th. But as I said, no holds go on until November. So you've got a little extra time there if you're having trouble with things like getting out of the vaccines or documentation translated. So there's a little bit of a buffer there.
In the TB questionnaire, it asks if we live in a TB prone area. I live in India. How should I answer that?
Yes, that question often, no matter how we word it, often causes a little bit of confusion. So the only parts of the world that we know don't have endemic TB is North America, Australia, and New Zealand, and Western Europe. So if you're residing in any other country in the world, you will need to get TB testing. And as I said before, India has a lot of tuberculosis, unfortunately, so it's very important that you get tested. And you would answer yes to that question.
Is the meningococcal ACWY vaccine mandatory?
It is required for UC incoming requirements, but if you're not if you can't access it in your country, you can get it here, and many people do.
Should I contact someone through Ask a Nurse now if I want to get the updated COVID-19 vaccine in the fall, or should I wait until I'm on campus?
Just keep an eye on the online bookings, and once that becomes available, you can just book your own time. Sending us a message now really isn't probably going to help too much. So just start at the end of August and in September, start looking at start looking for appointments, and you can book in very easily into one of our clinics.
I am 20 years old. Does the MCVAC vaccine received at age 6 satisfy the meningococcal vaccine requirement?
It doesn't, unfortunately. It needs to be on or after your 16th birthday. So this vaccine lasts about 5 years. It sort of starts waning between 3 and 5 years. So if you received it at 6, it's unlikely that you have much immunity left from that vaccine. So we really need you to have a more recent dose, just one single dose.
Is it okay that my most recent influenza vaccine was in 2016, or should I be receiving another one this year?
Yeah, receive one in the fall, so you'll have next to no immunity left from the one in 2016. If you've had influenza in the meantime, then there may be a few antibodies floating around. But yes, get a vaccine, a flu vaccine in the fall.
How can we indicate that we want to postpone our flu/COVID vaccine until the fall? Is there a place to indicate it on the form?
No, because this was something that was developed on an option that came up after I put the form together. So you can write it on the form if you want, or you can send us a message and we can postpone that for you.
Right. I had one Tdap dose at age 11, but haven't received one since then. I'm 25 now. Do I need to get another one?
Um, as far as the requirement goes, you meet it. But again, same as the previous question, we need to get boosted for tetanus every 10 years. And so I would recommend that you get a booster just for health reasons.
So, do we have to have all 6 COVID vaccine because I was under the impression that only the first 2 were required.
No, you don't. So the current one is what is the requirement sits around now. So those early two, we called them primary doses, and yes, that's what formed most of the part of requirements in most settings. But now we know those vaccines were important for protection and coverage during that time, but no longer are we going to get much immunity. So we really want people to have an updated dose.
I have received the DTaP before, but never the Tdap after age 7. If I cannot get it in time for July 10th, can I leave it blank and get it through UCSD once the quarter begins?
You definitely can.
For the varicella vaccine, did you say 2 doses are required if I got one recently and one when I was very, very young? Does that suffice?
Yes, as long as it wasn't before your first birthday, that first one does count.
I have a TB skin test record from when I was volunteering last November. Is that sufficient?
Yes, that's fine.
Is there any preference on how we should submit the form? For example, PDF, Word?
Whatever works.
Will I be able to sign up for classes if I'm missing vaccines?
You will. You will because you'll have until November 1st to get those missing vaccines. But if you get a hold on November 1st, you won't be able to enroll in winter classes.
Yeah. Some of my vaccine records are documented in China, the rest are in the US. Both records are in English. However, the name on my Chinese record is under my Chinese name, while the US record is under my English name, which is my legal name. My Chinese record does not have my birthday documented. Is that sufficient enough proof?
Um, it's a really good question. I would recommend that you submit it and we'll take a look and see how, yeah, just submit it and we can reach out to you if there's any issues.
Do I still need to fill out the forms if my MyChart shows all of the dates and requirements are met?
No, you don't need to fill out the form, but I do want you to make sure that that your compliance has been activated, and so please reach out to us.
Okay. Okay. I am the person who mentioned that my medical records not requiring meningococcal. Right now I am 18. Does this change any advice you gave me earlier regarding my previous question?
It doesn't, no.
Do we need to provide proof of external health insurance in order to? So during this webinar, we are only focusing on immunization, and I will drop in the chat here all information that you can go to for insurance questions. If I miss the deadline of July 10th, will I have another opportunity to submit them at a later date if there's any issues that stop me from sending them at the deadline?
There's nothing that'll stop you, so it's always available and open for you to submit as soon as you can.
Do we need to submit the UCSD TB form, or is one by a clinic sufficient if we already have TB testing results from the past year?
Yes, you can submit what you have, and if there's anything, any questions we have, we can reach out to you.
Do we need to get TB testing if we live in North America?
Potentially. So there are 5 questions, and only one of them is regarding where you live. The other one is about, have you vacationed outside of the US for a month or more? Have you been around someone with TB? And there's several other questions. So the answer to that is just let the system guide you.
To accurately fill out the vaccine history, do I manually input the dates of the required vaccine on the MyChart website, as well as document or upload proof of vaccine history, which includes my doctor's signature, or is it one or the other?
It's both. So put in the dates and upload a vaccine record.
Perfect. Are any of the deadlines different if my graduate program starts on July 1st?
No, you've just got an earlier start date. So we would ask that you submit TB testing before you come onto campus. But we understand that the graduate programs do have sort of a rolling admission, and we're very used to that. So just get all of those things done as soon as you can.
If I submitted my medical records but forgot to add a required vaccine, how do I add that in my chart? In particular, submitting a photo of my record, or do I need to restart and submit my records again?
Well, if you've already submitted, you won't be able to submit again, but you will be able to attach a record to to Ask a Nurse message, and then we can add anything that you may have forgotten. Just let us know where the error was.
How recent do you want the doses of the vaccines to be?
It really depends on the vaccine. So childhood vaccines will meet the requirement for MMR and varicella, 11 years old and after for Tdap, and 16 and older for meningococcal. And then the flu and the COVID is you can get those during the fall.
May I know the valid duration of the TB test results?
A year.
Flu is not on the form as a required or recommended. When is it due?
During the fall quarter.
I got my MCV4 vaccine 3 months before my 16th birthday. Does this count as for the medical records, or should I update this dose if I'm under 22?
It really depends how long ago that was. So if it's been more than 3 years since you got that dose, I would recommend you get another dose. If it's been less than 3 years, please reach out to us or enter that date in, and we will take a look at it for you.
I have received two um,
Bexero.
Bexsero vaccines, thank you, Annie, after the age of 16. What does that cover?
That's actually a meningococcal B brand, and so doesn't form part of the requirement, but some of you may have received that with your healthcare providers, and so you have the option of entering those in.
And this is going to be our last question of the day as we're closing in on our hour. I think my healthcare lost the record of some of my vaccines I took when I was young. Do I need to get a blood test to prove that I've met these requirements?
Yes, MMR and varicella you can get blood tests for, and then you may need to get Tdap and meningococcal again, but just depends what records you can't find. Thank you so much, everybody.
Yes, thank you so much, everyone. If you have more questions, please message Ask a Nurse in my student chart. And then I also added the email if you're having technical difficulties, please email shstv@health.ucsd.edu. We will see you soon. Thank you.
Thank you, everyone.